Good evening, friends. Welcome to my channel. So today we are going to discuss about the spotters which usually ask from the lower limb. In our previous classes, we have discussed about the spotters which usually ask in the head and neck, neuroanatomy, and the upper limb we have discussed. Now we have come to the lower limb. In this today's class, I am going to show the pictures from the hip bone, then a femur. Then in the next class, I'm going to discuss about the tibia, fibula, then articulated foot. So before going to explore this channel, before going to explore this video, please subscribe to my channel. Thank you for your support. Let's get started. So in this first bone, that is hip bone, what are the questions usually they ask? So I am dealing the hip bone. I have taken the left-sided hip bone. Here you can see that this is the anterior aspect and this is the posterior aspect, and entire this surface is called as the outer surface. It is also called as the regarding the upper part of the hip bone, that is occupied by the ilium, and the posterolateral aspect is occupied by the ischium, and antero-inferior part is occupied by the pubis. So the ilium, it is having the two surfaces, outer surface and inner surface. So the outer surface is also called as gluteal surface. The inner surface is also called as pelvic surface. So how to identify the outer surface and inner surface? As you all know that. So the outer surface, which is called as gluteal surface, where we can identify the U shape, inverted U shape, the socket called as acetabulum. So I'm going to show all the features and what are the questions usually they ask, how they ask, I'll let you know. So the first and foremost question which usually they ask is, they may mark this particular area and ask you to identify that. So it is acetabulum, and what the question might they may ask in the examination, examiners they may ask is, so it is forming which joint? The socket which is forming, and what is the joint formed by this particular area? So that's how they may ask in the examination. So that is nothing but the acetabulum, and it is forming the socket, ball and socket, in the ball and socket type of hip joint. The socket is contributed by this acetabulum, where we can identify the three bones, ilium, ischium, pubis, which are going to fuse with each other in this particular area. Okay, so that is about acetabulum. And next thing which we are going to see is this gluteal surface of ilium. So gluteal surface of ilium, they may mark on this gluteal surface of ilium. So they may mark the gluteal lines, and they may ask you to identify the lines, and they may ask you to identify the muscle attachments to this gluteal surface. So gluteal surface name itself, it is giving you an idea, that is gluteus maximus, medius, and the minimus. So maximus posteriorly, so below the inferior gluteal line, where we can identify the gluteus maximus is arising between the posterior gluteal line and the inferior gluteal line, we can identify gluteus medius, and between anterior and the posterior gluteal lines, so that is the area which is giving origin to the gluteus minimus, medius, and the maximus. So these are the muscles which are attached to this gluteal surface of ilium. Next, we are going to see any other feature, any other bony feature they may ask is the ischial spine. So below to this greater sciatic notch. So this notch, which is exactly present posterior inferior to this ilium, this notch is called as greater sciatic notch. Then the lower end of the greater sciatic notch, where we can identify a spine which is projecting posterior medially, that is called as ischial spine. So ischial spine. So next question they may ask is, what are the attachments of this ischial spine? So ischial spine attachments are sacrospinous ligament. Okay, sacrospinous ligament, which is attached to this ischial spine. The next one is ilium. Regarding the ilium, posterior part of the ilium, there are two spines are present. One is posterior superior iliac spine. Then below that one is posterior inferior iliac spine. This is nothing but the posterior inferior iliac spine. Then moving to the below to this ischial spine, just below the ischial spine, you can identify a small notch. That notch is called as lesser sciatic notch. Lesser sciatic notch. And then posterolaterally, we can identify the roughened area. That roughened area, is called as ischial tuberosity or ischial tuberosity. So ischial tuberosity, they may mark and ask you to identify the muscle attachments to this particular area. So the hamstring muscles which are arising from this ischial tuberosity. Okay, so next one is, yeah, here I have just turned it posteriorly and try to show clearly how the ischial tuberosity is present. So this is the ischial tuberosity, and now what are muscles attached to it are the hamstring muscles. Hamstring muscles. If you remember the names of the hamstring muscles, you can write that, or better to write the hamstring muscles and write down the muscle names: semimembranosus, semitendinosus, and the long head of biceps femoris. They are arising from this ischial tuberosity, and the lower triangular area, this triangular area of the ischial tuberosity, which is giving origin to the hamstring part of adductor magnus. Hamstring part of adductor magnus. That is about ischial tuberosity. So now we have turned it inwards and try to see the features of the hip bone from the inner aspect. Or so this surface, entire surface is called as pelvic surface. So the upper part of the hip bone is occupied by the ilium, as I told you earlier. Posterior-inferiorly, it is occupied by the ischium. Anterior-inferiorly, it is occupied by the pubic bones. Okay, so coming to this features one by one, let us see that. So the anteriorly we can see the anterior superior iliac spine. So the question asked from this anterior superior iliac spine is very tricky. They may ask what is the muscle arising from this particular the bony part, and what is the ligament attaches to this. Okay, anterior superior iliac spine, one muscle, one ligament. So as you all know that it is sartorius and the inguinal ligament which is arising from this particular anterior superior iliac spine. Fine. Then below this, we can identify anterior inferior iliac spine. Anterior inferior iliac spine. So what is the one muscle and one ligament attaches to this anterior inferior iliac spine. So one muscle, there is a rectus femoris, which head that you have to study. Okay, straight head which is arising from this anterior inferior iliac spine, and the ligament which is attaching to this anterior inferior iliac spine is iliofemoral ligament. Iliofemoral ligament which is arising from this anterior inferior iliac spine. Then fine, next we are going to see the next feature is next here you can see the arcuate line or linea terminalis, which is separating the pelvic cavity, pelvis into true pelvis and the false pelvis. Below the arcuate line, that is true pelvis, it comes under the true pelvis. Above the arcuate line, that particular area will comes under the false pelvis. So arcuate line, that what is present above the, how it is separating the pelvic cavity, like that they may ask. So how it is separating the pelvic cavity means, so it is separating the pelvic cavity into upper greater pelvis, lower lesser pelvis. Upper part is called as the false pelvis, lower part is called as true pelvis. Like that you can answer in your examination. Fine, next feature is, yes, pubic symphysis. So pubic surface of the pubic bones, that is which is going to articulate with the opposite side of pubic bone, where we can call it as pubic symphysis. Okay, so which type of joint it belongs to, that they may ask. Pubic symphysis comes under which joint, which type of joint. Next one is the surface called as sacroiliac surface. So they may mark this particular area and ask you with which bone it is articulating, with which bone it is going to articulate. Sacroiliac surface, which is articulating with the lateral surface of the sacrum and forms the sacroiliac joint. Sacroiliac joint. Next thing is, here you can see that the pelvic surface of ilium. So the pelvic surface of the ilium, there we can identify the depression, that is called as iliac fossa, and the muscle which is arising from this particular area they may mark in the examination. It is marked, and the question asked from this is, what is the muscle arises from this particular area? So that is iliacus which is arising from it. Okay, so that is about the questions usually they ask from the pelvic surface of the hip bone. Next, we are going to see the upper part of the hip bone. It is also very important. So upper part of the hip bone, try to see carefully. Yeah, I am going to mark it here like this. Yeah, okay. So this is about the iliac crest. So iliac crest attachments they may ask from anterior to posterior. They may mark this particular area, and then what are the two muscles arises from the outer lip or inner lip. So when you study the iliac crest, you have to study about what are the muscles attached to the iliac crest from outside to inside. So outer lip, what are the muscles attached? Inner lip, what are the muscles attached? That you have to study once again. Okay, then the next feature is the iliac tubercle. Let me show you that iliac tubercle. I am going to show in the next slide. But remember, iliac crest attachments you have to study. Okay, so the posterior part, which muscles are attached, anterior part, which muscles are attached from outside to inside, like that they may ask. Okay, so you have to be careful when you are writing in the examination spotters exam, especially. So the question may be tricky. Okay, they may ask the iliac crest attachments from outside to inside or inside to outside. So, and another question, the another part they may specifically they mention anterior part of the iliac crest muscle attachments from outside to inside, posterior part of the iliac crest attachments from outside to inside or inside to outside, like that they may ask in the examination. So be careful when you are writing about this iliac crest. And iliac tubercle, what is a plane passing between the right and left iliac tubercles, that they may ask. Okay, that is transtubercular plane. Yes. Now I'm just showing the hip bone from anterior aspect, from the anterior aspect. Let me show you that. So what are the features we can identify if you just observe the hip bone from exactly from anterior, from the front view? So here you can see a crest. That crest is called as obturator crest. They may mark this in the examination and ask you to identify that. So that is obturator crest. So probably they doesn't ask this, but if the examiner wanted to give you a tricky question, he wanted to know how much you have studied, they may ask this obturator crest. The next one is the pubic tubercle. So pubic tubercle, just medial to this obturator crest, we can identify the pubic tubercle. So pubic tubercle attachments, they may ask. Pubic tubercle attachments. Do you remember that? So the inguinal ligament, which is attaching from the anterior superior iliac spine to the pubic tubercle. Okay, so you can write it as inguinal ligament. The next one is the ischiopubic ramus. Ischiopubic ramus. So ischiopubic ramus, it is having outer surface and the inner surface. Outer surface, what are the muscles attached from the outer surface, they may ask. So you can write the adductor brevis, adductor longus, you can write. And from the pelvic surface, you can write it as the, what do you say, ischiocavernosus muscles. Ischiocavernosus muscle, they may arise, they are arise from the everted part of this ischiopubic ramus. Okay, so that is about the ischiopubic ramus. And the lower margin of this obturator foramen, you can write it as obturator externus. Now we are moving to see this foramen is called as obturator foramen. Outside to this hip bone, just below to this obturator foramen, you can write it as obturator externus. Then we are moving to see the femur. So far I have discussed about the hip bone, and we are going to see the femur. So here also I have chosen the left-sided femur. Yes. In this first picture, I have just separated the femur into three parts: upper end, shaft, and the lower end. So what are the questions usually asked from the upper end of the femur? Let me show you that. So the first feature here, here the head part of the femur, they may mark it and ask you to identify that particular area. So you have to write it as head of the femur. And what is forming it is? It is forming the hip joint. It is forming the hip joint, and it is going to articulate with the acetabulum of hip bone and forms the hip joint. Okay, so here head is representing the ball, and acetabulum is representing the socket. Okay, ball and socket type of joint. Fine. Next, we are going to see the just below this head, the constricted part. Here, entire the circular area, in the circular area may be marked and ask you to identify that particular area. So what is it? It is called as neck of the femur. Neck of the femur. Then we are going to see the lateral to this neck of the femur. The projection is called as greater trochanter. Greater trochanter. So the neck and the greater trochanter. Greater trochanter muscle attachments they may ask. Okay, so on the greater trochanter, it may be marked and ask you to identify what are the muscle attachments to this particular area. Okay, greater trochanter muscle attachments, you have to go through it. Then here you can see that below this greater trochanter and below the neck, between this greater trochanter and the lesser trochanter, this small part which it is hiding just behind that it is called as a lesser trochanter. And between these two trochanters, from the anterior aspect, what we can identify is intertrochanteric line. Remember carefully, intertrochanteric line. So the line which we can observe, we can find from anterior aspect. Okay, careful, be careful. So intertrochanteric line which we can identify from the anterior aspect, right? Fine. Now I have just turned it, rotated it and try to see that. Yeah, I have rotated it like this. And I'm seeing the femur from the medial aspect. From the medial aspect. So what we can identify from the medial aspect? So here you can see a depression. So this depression, depression may be marked and identify that particular area. What is it called as? It is called as fovea. Fovea. So what are the structures present in it? That you have to study. Structures present in the fovea, right? Then the hidden part which I have told you earlier, that we can see clearly when you observe the femur from the medial aspect, that it is called as lesser trochanter of femur. So lesser trochanter of femur attachments they may ask. Okay, so try to remember the two muscles which are attaching to the lesser trochanter, iliacus and the psoas major. It is forming the common tendon which is attaching to this lesser trochanter. And medial to this greater trochanter, we can identify the depression. That depression we can see clearly when you observe from the medial aspect. When you observe from the medial aspect, that depression is called as trochanteric fossa. Trochanteric fossa. Try to study the attachments of this trochanteric fossa as well. Then we are moving to the posteriorly, we can see the crest clearly between the greater trochanter and the lesser trochanter. That crest is called as intertrochanteric crest. So from anterior aspect, which we can identify intertrochanteric line. From the posterior aspect, we can identify intertrochanteric crest. Then what we are going to see here is, on the intertrochanteric crest, we can identify a tubercle, a small tubercle. That tubercle, the tubercle may be marked, that particularly on the intertrochanteric crest, means posterior aspect of the femur, head of the femur. We can posterior aspect of the upper end of the femur. There we can identify intertrochanteric crest. On the intertrochanteric crest, the bony projection which is present on the crest is called as quadrate tubercle, which is giving, so which muscle is attaching to this quadrate tubercle, that may be asked. So quadratus femoris, that you have to write. Then we are moving to the cylindrical part called as shaft of the femur. Shaft of the femur. So what are the muscle attachments? So I have just turned it posteriorly. So behind, it is posterior aspect of the shaft of femur. There we can identify the bony projection, a line like bony projection called as linea aspera. So this linea aspera may be marked and ask you to identify the muscles attached to it. So it is very easy. If they ask such a questions, it is very easy to write because so many muscles which are rising and inserting to this particular area. So the linea aspera, which is giving origin to this quadriceps muscles, vastus lateralis, vastus medialis, vastus intermedius, which are arising from this linea aspera lateral in the medial aspects. And at the midline, where we can identify the adductor brevis, longus, and the adductor brevis and the longus, which are attaching to it. And the vertically, they are getting the tendinous insertion. They are going to attach to this linea aspera. So the question might be very specific. The question may be like that. They may ask. So two muscles attached to it, or two muscles arises from it. So what the two muscles arises from it, that you have to write as vastus lateralis or medialis or intermedius. So what are the muscles, two muscles inserting to it, that you have to write the brevis and longus inserting. Brevis and longus are inserting. Then upper part of the linea aspera, pectineal line may be present, that which is giving insertion to the pectineus muscle. Okay, so that you have to remember carefully, and when you are writing the answer, please observe the question properly. Linea aspera. Okay, then we are moving to the lower end of the femur. Here you can see that lower end of the femur from the anterior aspect, what we can identify. Let me show you clearly. Here you can see that adductor tubercle, which is giving adductor tubercle. It is marked and asked you to identify the muscle attachment to that particular area. So adductor magnus, which is attaching to this adductor tubercle. Then below to this adductor tubercle, we can identify medial epicondyle. So where we can identify the adductor tubercle? Medially, we can identify the adductor tubercle. Remember carefully. Just below the adductor tubercle, we can identify medial epicondyle. And below this medial epicondyle, we can identify the medial condyle of femur. So try to remember the muscle attachments of this medial epicondyle of femur and the adductor tubercle muscle attachment. Okay, now I'm going to turn it posteriorly to see clearly. Yes, so in this first picture, it is anterior aspect of the lower end of the femur, and in the second picture, you can identify the posterior aspect of the lower end of the femur. So what are the features which we have seen earlier? Adductor tubercle we have seen, then we have seen the medial epicondyle and the medial condyle. Now, obviously, laterally, this is the lateral part where we can identify the lateral epicondyle, lateral condyle. Okay, and this surface, let me show you clearly one by one. Yes, I'm going to turn it like this and try to see here the posterior aspect of the lower end of the femur. Now, this is the lateral epicondyle of femur. Then here you can see here. So as we have turned it posteriorly, and here you can identify the lateral epicondyle of femur. Then below this we can identify the lateral condyle of femur. Then between the medial and the lateral condyles of femur, where we can identify the depression, that depression is called as intercondylar fossa. So what are the structures present in the intercondylar fossa, they may ask. Okay, try to study the structures attached to the intercondylar fossa. Okay, friends. Then the surfaces. So here you can see anterior part of the lower end of the femur. This surface is called as patellar surface. Where it is going to articulate with the patella. Then posteriorly we can identify this surface is called as popliteal surface. Of femur. So that is about the lower end of the femur, and the questions usually they ask from the femur. Thank you, dear friends. See you soon with a new video from the tibia, fibula, and the articulated foot. Thank you. See you soon, guys.